Complications can occur after any surgery. In this video, I will educate you on potential complications, their signs and symptoms, and what to do if you suspect a complication. Pain is common following surgery. Here at Coordinated Health, our surgeons use what is known as multimodal pain management. This combines minimally invasive surgical techniques with 2 or more pain-relieving medications and mechanisms to relieve pain and reduce the need for narcotics. Following surgery, you are likely to experience some pain and discomfort. The hospital care team at Coordinated Health will do everything that we can to try to keep the pain at a comfortable level. Please inform the nursing staff as soon as you feel discomfort. Our multimodal pain regimen always has a next step to help treat any uncontrolled pain. Following discharge, if your pain becomes unbearable, please call your patient navigator. Remember, your pain will resolve. Nausea and vomiting are an unpleasant and common occurrence after surgery. We try to employ special types of anesthesia, including what are known as nerve blocks, to minimize or eliminate the need for general anesthesia. This greatly diminishes the risk of nausea and vomiting. On the day of surgery, you will meet with the anesthesiologist. Remember to let him or her know if you have experienced nausea or vomiting after previous surgeries. If this has happened to you before, the anesthesiologist and nurses can give you specific medications to help prevent or lessen nausea. As with pain, nausea and vomiting resolve in the days after surgery. One potential complication is deep vein thrombosis, commonly referred to as DVTs. A DVT occurs when a blood clot forms in one or more of the deep veins in your body, usually in your legs. Orthopedic surgery, especially knee and hip replacement, increases the risk of these clots. Signs and symptoms of a DVT can include increased calf swelling, increased pain or tenderness in your calf, and redness in the lower extremity or calf pain. However, it is important to know that sometimes DVTs can occur without any of these symptoms. After your surgery, you may wear special elastic stockings called TEDs. These stockings are typically worn for 6 weeks after your surgery. They can be taken off at night. While in the hospital, you will also wear calf pumps that routinely inflate and squeeze your leg while you are in bed. Both of these measures can help reduce your risk of DVT. We also get you up and walking early after your surgery, often on the same day. The more you are walking, the lower your risk of clots forming. Additionally, we work with your surgeons and use medicines to thin your blood to lower your risk of DVT. Depending on your history and other medical conditions, these medicines may range from an aspirin to newer blood thinners. You must take these medicines as prescribed and for the duration of the time we tell you. Please note, the stockings are easier to put on prior to swinging your legs out of bed in the morning. While sitting, you should elevate your feet above the heart and perform ankle pump exercises 10 times per hour as instructed by your physical therapist. After surgery, frequent mobility is encouraged. You should walk 10 to 15 minutes every hour. It is important to remember that despite all of these efforts, there is no way we can completely eliminate the risk of a DVT. So it is important to look for the signs and symptoms we discussed and call your patient navigator if you think you have a DVT. Another potential post-operative complication is constipation. Even if you have regular bowel movements prior to surgery, you are likely to experience constipation after surgery. Exposure to anesthetics and narcotic pain medications, changes in your diet and fluid intake, and reduced physical activity contribute to constipation. To help prevent constipation during recovery, you can take an over-the-counter stool softener, drink plenty of water, and eat foods high in fiber. By following these recommendations, constipation will resolve. You may not have a bowel movement while in the hospital, but as long as you are passing some gas, you will be okay. A surgical site infection is an infection that occurs after surgery in the part of the body where the surgery took place. Some signs and symptoms of an infection are increased swelling and/or redness at the incision site, change in the color or amount of drainage coming from your incision, increased pain in the extremity, fever of 101 degrees or higher. If any of these things occur, please call your patient navigator so we can get you seen by one of our providers. The provider can then do the appropriate exam and testing to determine if you have an infection. If an infection is suspected, this provider will speak to your surgeon to determine how to best treat the infection. Your physical therapist is also an excellent resource. They will communicate any concerns you have directly to the patient navigator or the physician. Serious complications after surgery are rare. However, if you experience any of the following symptoms, call 911 immediately. Chest pain, difficulty breathing, shortness of breath, or confusion. In summary, you should call your patient navigator if you suspect a surgical site infection, have symptoms of a DVT, or have uncontrolled pain. You should call 911 immediately if you experience chest pain, difficulty breathing, shortness of breath, or confusion.